Hello and welcome. Today, we're diving into a really important topic, something that can feel like a sudden, confusing turn on a long road: post-mastectomy radiation. Our goal here is to just demystify it. We're going to look at the proof, break down what it is, why your team might be talking about it, and what it all means for you.
You know, this is the question at the heart of it all. You've gone through a major surgery, you've been told the tumor is out, and it feels like you should be able to close that chapter. So why on earth is the treatment not over? It's a totally valid question, and to answer it, we have to go microscopic.
All right, so let's get right into it. What exactly is this next step we're talking about after surgery?
So it's called post-mastectomy radiation therapy, or PMRT for short, and it's basically a highly targeted treatment using high-energy X-rays. The beams are aimed right at the chest wall, where the breast tissue used to be, and a lot of the time also at the lymph nodes nearby. The whole point is to stop cancer from ever coming back in that same area.
But you're thinking, the surgeon got it all out, right? Well, yes, they removed everything they could see and feel. But the tricky thing about cancer is that it can leave behind these invisible microscopic cells, these little microtumors that are just too small to be seen. Think of radiation as a super-powered cleanup crew. It's there to zap any of those tiny cells left behind before they get a chance to grow into a new problem. This is especially important when we hear about positive margins, which just means some of those cells were right at the edge of the tissue the surgeon removed.
Okay, so we know what it is. But the big question, the one that really matters, is, does this stuff actually work? Well, let's look at the evidence, because there's a lot of it. The data we have from these huge landmark studies is just incredibly consistent. Researchers in Denmark and British Columbia asked a really simple question. For patients with a high risk of recurrence, what happens when we add radiation to their treatment plan? And the answer was, wow, pretty dramatic. Across the board, adding PMRT cut the risk of the cancer returning to the chest or lymph nodes by about 2/3. That is a massive reduction. But here's the real game changer. This wasn't just about stopping cancer in one spot. This is the part that gives me goosebumps. Those same studies found that by stopping the cancer locally, they actually saw a significant jump in 10-year overall survival. So let that sink in. Better local control directly leads to people living longer lives. That's what it's all about. So, with results like that, you might be thinking, okay, so everyone gets it, right? But nope, that's not the case. It's not a one-size-fits-all treatment. The decision is super personal, and it really comes down to which of these two groups you fall into.
Let's think of it like this. On one side, you've got a group where the decision is pretty clear-cut. If cancer was found in 4 or more lymph nodes, the data is so overwhelmingly positive that PMRT is pretty much always recommended. But then there's this other group where maybe only 1 to 3 nodes were positive. For them, the guideline is to strongly consider it. And that phrase is key. It means it's not an automatic yes, it's the beginning of a really important conversation.
So for that strongly consider group, what helps make the decision? Well, doctors look for other clues, other high-risk features, things like the tumor being very large, or a high grade, meaning it's more aggressive. Or maybe the lab report mentions something called lymphovascular space invasion, LVSI, which is just a fancy way of saying cancer cells were seen in the tiny blood or lymph vessels. And of course, those positive margins we talked about. Any of these things can tip the scales, pushing the conversation more towards recommending PMRT.
Okay, let's shift gears and tackle one of the biggest, most practical questions people have. If I need radiation, does that mean I can't get breast reconstruction? This used to be a huge worry, but today, things have completely changed. It's really more of a modern partnership now.
And the secret to this partnership is a really smart 2-step process. Here's how it works. First, during the mastectomy, the plastic surgeon places a temporary tissue expander. Then, you go through radiation, and the radiation is aimed right at that expander. Now, here's the most critical part. After radiation, you wait. There's a healing period of about 4 to 6 months. This lets all the tissues recover. And only then, after everything is settled down, do you have the final surgery to swap the expander for the permanent implant. It's the timing that makes all the difference.
And hey, don't just take my word for it. This is standard practice. The medical literature, like this quote here, is very clear about it. They say that waiting about 6 months after radiation is the way to go. And it's for a great reason.
That waiting period allows the radiated skin and muscle to heal and soften, which gives a much better, much more stable result in the long run with fewer problems.
So what does this look like in the real world? This chart is so telling. It shows two things happening at the exact same time. First, you see that doctors started using radiation more for this group of patients. But look what else happened. At the same time, the number of women in that very same group getting reconstruction also went up. The message here is loud and clear. Needing radiation and getting reconstruction are not at odds anymore. They can and do happen together successfully.
So, we've laid out the benefits pretty clearly. But let's be real. No medical treatment comes without potential risks. So for this last part, let's talk about those risks, and more importantly, how today's approach to radiation is all about minimizing them. You have to understand, radiation today is not your grandmother's radiation. It's undergone a total revolution. The old studies used these flatter 2D techniques that were kind of like using a blunt instrument. They treated the cancer, but a lot of healthy tissue, like a heart and lungs, got a dose too. Now, the standard is 3D conformal therapy. They use a CT scan to build a perfect 3D model of your body so they can shape the radiation beams to wrap right around the target while avoiding everything else. It's night and day.
And that's not all. The modern toolkit is just packed with amazing technology. There are even more advanced techniques, and one of my favorites is called Deep Inspiration Breath Hold. For left-sided cancers, it's so simple and so brilliant. You just take a deep breath and hold it for a few seconds. That breath fills your lungs with air, which literally pushes your heart down and out of the way of the radiation beam. It's an incredibly effective way to protect the heart.
Minimizing risk is also about smart planning. It's not just what you do, but when you do it. Take a common hormone therapy like tamoxifen. Research has shown that if you take it at the exact same time as you're getting radiation, what we call concurrent therapy, there might be a slightly higher risk of lung irritation. Because of that, a lot of doctors now prefer a sequential approach. You finish one treatment, then you start the next. It's all about maximizing safety.
So, after all that, what can you actually expect? Well, this gives us a pretty good balanced picture. The most common things, like feeling tired and having some skin redness like a sunburn, are usually pretty mild and they go away. Lymphedema, or swelling in the arm, is less common. And those really serious side effects we worry about, like issues with the lungs or heart, thanks to all that modern technology we just talked about, they are now thankfully rare.
So let's just pull this all together. What's the bottom line? For the right person, post-mastectomy radiation is a proven, life-saving treatment. The evidence is clear that it cuts down recurrence and helps people live longer. And just as importantly, with all the incredible advances in technology and planning, it is safer than it has ever been, and it absolutely can be integrated successfully with breast reconstruction.
Really, the whole point of this explainer was to give you the knowledge to feel more confident. So the final question isn't for me, it's for you. Now that you know the benefits are so clear and the risks are so much lower than they used to be, how does this change the conversation that you can have with your doctor? Because that shared conversation, that's the one that truly matters. Thanks for joining us.